you need to know how to normally take a blood pressure, because there's going to be all kinds of people taking your blood pressure. And you need to be able to check them when it's wrong. There are some do's and don'ts when it comes to taking a blood pressure. Anybody can wrap that deal around your arm and press a button, but if they don't have you in the right posture, in the right position, doing the right things, then the reading you get may be wrong. And now they're increasing your blood pressure medications. They're starting you on medications and you're having side effects. You have to deal with all the implications as a result of that reading. So we all got to be on the same team as far as making sure those readings are correct. So today we're going to be talking about how to properly measure the blood pressure. This is very important, okay? Whether you have high blood pressure or not, you need to know how to measure your blood pressure correctly. Here's one thing. You need to know how to measure your blood pressure correctly because you need to know what's normal for you in your habitat, okay? A lot of times when you are translocating, perambulating, going to the clinic, your blood pressure may be high just because that's a stressful event. Maybe you have white coat hypertension. Maybe you are scared. Maybe you have a lot on your mind, which makes sense. I've been to the clinic before. I've been a patient before. So I know what it's like to be a patient, being in the clinic, and having the blood pressures be high because you're tense. Okay, you have so many things running through your mind. But if you don't know what your normal blood pressure is when you're relaxed and in your home and calm day to day, then how do you know that that's not an abnormal blood pressure? Okay, when the doctor looks at you and says your blood pressure is high, we're going to increase your medications or we're going to start you on medications. How do you have an argument as to what is normal for you? How can you say, hey doc, this is abnormal? Okay, my blood pressure is usually in the 110s at home. This 140 is abnormal. This 150 is abnormal. See, check out my pulse. This is abnormal. You can't do that if you don't have a basis, if you don't have that log of normal. So a lot of times when your PCP, your healthcare provider, your physician, your doctors are telling you, keep a log. This is why. The log is not so much for them, but for you. A lot of times, you're bringing in that log to show them, but that log is really for you because you need to establish your normal. Now, the first thing you're going to need is a blood pressure monitor. Now, you can get a blood pressure monitor from a lot of different places. You can get it on Amazon. You can get it from Target. You can get it from the Walgreens, the CVS, it's whatever. Wherever you want to get your blood pressure monitor from, have at it. You can get a discount. You can get a prescription. You can get a recommendation from your doctor, health, whatever. That's your prerogative. But you do need a blood pressure monitor. Now, a lot of times, I have two things to say about these blood pressure monitors. One, I prefer you get a blood pressure monitor that you put around your arm. Okay, that's what I'm used to. The ones around the wrist, I don't know how accurate they are. And I'm going to go back and I'm going to read into this, but my understanding is that they're not as accurate as the one that you put around your arm. You want to go there first. Unless you have some issue with it, some reason why you cannot measure your arm pressures. I know that there are certain populations that cannot measure the arm pressure, whether you have like a fistula or a graft, or you've had surgery, or your lymph is not flowing, you've had breast surgery. There may be reasons why you can't use your arm. And in that case, you may have to use your wrist. But that's between you and your physician, and they'll let you know if you're of that population. So we have this blood pressure monitor. And like I said, it's an arm blood pressure monitor. The next thing you want to do is you want to make sure that it fits you. A lot of times when you get the blood pressure monitor, it will tell you how big the circumference in the measurement around the arm is. It will let you know. Okay, so here we have that. And sometimes, I don't know very many people who just measure their arm circumferences or know that measurement, but it'll have like indications of a small person, a medium person, a big person, a baby, pediatric. So you can use that to gauge to see where you fit in. But you definitely want to get in where you fit in, okay? Because if this blood pressure is too small and it's too tight, you can imagine that when it gets to going, the number is going to be too high. And if the blood pressure monitor is too loose, you can imagine when it gets to going, the number is going to be too low. So this is another good reason to not only have the appropriate sized cuff at home, but when you get into the office, you want to make sure they're using the appropriate sized cuff, okay? When you get in there and they're bringing out a cuff from wherever and they're being really fast and they're tightening around your arm, if it feels too tight, you speak up, you say, hey, I don't think this fits. I've had clients, patients, and I've had followers who've told me that they've asked for an appropriate sized cuff, and it was a battle. It was a battle because maybe they didn't have it, but that is their responsibility to make sure they have the right equipment, the right tools and equipment to measure your blood pressure. So if they don't have it, they need to get it. And if you don't have it, you need to get it. I've had people who told me they've had to look on Amazon for the cuff that fits. And let me tell you, this cuff, if you get a monitor like this, it comes out of here. So you can then find the right cuff. You can find the right cuff and get whatever fits in here. So anyways, we're going to start with this cuff because this works for me. So you get your machine and you plug it in. All right, guys. So the next thing I want to talk to you guys about is how you're going to be postured. Okay, so posture is going to be really important when it comes to measuring your blood pressure. This is where I see people get it wrong, okay? You want to be relaxed. You want to sit down, okay? And you want both of your feet to be on the ground. And you want to just be sitting upright, 90 degree angle, just sitting upright with your feet flat on the ground. You don't want your feet crossed like this. You don't want your legs crossed. You don't want to be all hunched in. You don't want to be all folded. Because if you can imagine, that's pushing that blood, pushing that pressure up, and you're going to get a false reading. Okay? So this is not the time to be, oh, I got the coffee in my hand, chatting it up. You know, that's what's going to have your blood pressure abnormal. So when you get there, let them give you some time to just sit down, relax. You could do a little roll. Just bring it down, okay? So the next thing that's gonna be really important is your arm positioning, okay? So you want that arm to be at the level of your heart, right here. You don't want it in your lap or down, squeezed up against your body, and you don't want it too high, all right? You would think that people don't take it up here. I've seen it taken up here. I've seen all kinds of things, first of all. But when it's up high like this, you can imagine that pressure is down here, pressure's gonna be low. If it's down like this, pressure will be high. So you have to be really careful with that. Now, let's get this blood pressure cuff on. And we already talked about the importance of choosing the right cuff for you. So it should go on quite easily. So I like to have this here because that's where I like to consider my measurement as being taken in that brachial artery. But that's a little more than y'all need to know. Now, I've got my arm positioned here and I've got my posture good. Now, if you have a monitor that looks like this, it's not going to take much else. You're just going to press a button. Take a deep breath and press. So here's my blood pressure. It's 125/77, and you may or may not be able to see that. But that is a victory for me because, you know, I am a hypertension warrior for a reason. And I am thankful to have blood pressures like this. If you watch my other video, you see that this is normal, but it's not optimal. So I'm constantly working to get into the optimal zone. Now, I've taken my blood pressure, and that is not where I stop, okay? You don't want to stop there. Sometimes you may want to recheck it, okay? But if you are going to recheck it, I advise you to wait about a minute or two, okay? And then I also advise you to check it in the other arm. So you want to compare both pressures. And sometimes what I'll see is I'll have clients, patients, followers, all kinds of people tell me that My blood pressure is always higher in one arm than the other arm. What do you do when your pressure is always higher in one arm versus the other arm? Let's say your right arm always gives you 5 points higher. What I recommend is you go with the higher pressure, okay? Because high blood pressure puts you at risk for all kinds of diseases. It's not about the number. It's not about skating free. It's about reducing your risk, right? So if I had pressures that are always tending to be higher in one arm versus the other, I'm going to report the higher number so that I can make sure to reduce my risk as much as possible. So let's say I just checked in, it was 125 in my left arm, and it happened to be 129 in my right arm. I would go off of my right arm in that I'm starting to squeeze close towards stage 1 hypertension, sadly. Now, that being said, I did break some rules because I'm having green tea here as we speak. I need a little perk up. So that could have owed to why my blood pressure was just a tad elevated. And let's go ahead and talk about what could elevate your blood pressure, okay? Should I talk through it and let y'all see what happens? Because you really don't want to talk during your blood pressure. A lot of times what I find is that people are using this time to chat, get the rest of your history. What's your surgical history? I don't know. I think my mom, I don't know. She had some issues. She was in the hospital. Okay, so do you have any surgical history? I'd have to think. Well, yes, I did have a surgery in 2025. I didn't. But a lot of times, practitioners, techs, they're going to try to use this time to collect the history. Get 2 birds hit with 2 stones, or 1 stone. Now ain't the time. You see this? You see this? And I just checked my blood pressure on the other side. But because I was fidgeting, I was looking around, I was picking up stuff, look how high that is. Look how high that is. Now I want to show you where I relax, okay? And what it could be. Here is my blood pressure when I stop running my mouth. Can y'all see this? I need y'all to see this. This I need y'all to know that this is serious. I need y'all to know that this is serious. This is real. This is not a game. Measure your blood pressures correctly. Measure your blood pressures correctly because it is causing a lot of issues out here. Okay. Now, previously when I measured it, y'all didn't see, but my feet were crossed. Okay, I was leaned over, I was chatting, I was reaching for things, I was remembering, recalling, I was tense because I'm thinking about surgical history. I'm trying to remember, don't do it. When they're checking your blood pressure, it should be a zen time. You need to feel as grounded as possible because this is an important measurement. And I can imagine because you're not in your usual space, you're going to have a lot going through your mind. You're going to have a lot of adrenergic, you're going to have this fight or flight response because you're just not in a natural environment. You have a lot in your mind. You're getting a physical exam, for goodness sakes. So you have to calm down. You have to relax. Don't be trying to do everything. And if someone is having you do everything, don't be shy to say, give me a minute. I'm going to answer your questions, but I need this done real quick. Because all too many times I've had it happen to me. Someone's strapping something on you. They have your feet dangling and crossed. They have your hand down at your side. And they're talking to you and they're collecting information from you. And meanwhile, everybody is all confused when a number comes back high. I know what my normal is. I know where my normal lies. And to see 141, I would be confused too. So imagine if you don't know where your numbers lie and you get those kind of numbers. It would be really concerning. And you possibly could be starting on a medication that you may not need. So Tell me what your experiences have been. Have you had any issues with them checking your blood pressure? Have you had really high numbers? Do your numbers range high to low? Because a lot of times it may not just be the white coat hypertension, it could just be improper technique. So let's take out the improper technique.